practice, we don't really learn that in conventional medical school.
Right.
We don't get anything about nutrition, and nutrition is the most important component of wellness, and we don't get it. We all had to study that outside of our traditional training. And when you look at guys like this with amazing muscles and our practice, a lot of guys are even like, they see those guys and they'll get intimidated. They're like, I'll never get results like this. My big thing is trying to make people understand how important muscle is. Muscle is not just to look good,
right,
or to look good at the gym, to be without a shirt, but really it's the utilization of glucose that it does.
Yep.
It is the functionality.
Yep.
To me, muscle strength, grip strength has been one of the independent predictors of mortality as we age. Frailty for elderly.
Yep.
So to me, muscle, and for us doing testosterone, the combination of the right amount of protein with the amino acids and the right hormones to help you build, to help you use those building blocks. So not just to look good, of course, looking good is great, but also to prolong life, have a better life, better health span. So that was when I made that click, to be like, it's not just about building muscles just to build muscles.
Right.
It's about longevity and health span.
Yeah.